All right, community, it is officially noon. I have the great pleasure of introducing Dr. Wanjiku Njoroge, who's an assistant professor of psychiatry at the University of Pennsylvania Perelman School of Medicine, associate chair of diversity, equity, and inclusion for the Department of Child and Adolescent Psychiatry and Behavioral Sciences at Children's Hospital Philadelphia, and is a faculty member at Policy Lab and the medical director of the Young Child Clinic at CHOP. She is a practicing infant preschool psychiatrist. Her research areas have been on health equity, diversity, inclusion, with a focus on early childhood development and parenting practices. Her core areas of focus have been on prevention, promotion, and early intervention. And her recent work has measured the impact of the pandemic on the mental health and well-being of peripartum women and their developing children. She's active in multiple organizations, including the World Association of Infant Mental Health, 0 to 3, Academy of Graduate Fellows, Society for Research and Child Development, including the Society for Research and Child Development Black Caucus, American Academy of Child and Adolescent Psychiatry, Deputy Director of Program Committee, and she's Deputy Editor for the Journal of Academy of Child and Adolescent Psychiatry. She has published many articles in scientific journals, written multiple blogs, co-edited a textbook, The Clinical Guide to Psychiatric Assessment of Infants and Young Children, and most recently participated in multiple media interviews in print, radio, and television. It is such an honor to have you here. We're very excited. And I will go ahead and mute myself and pass the mic. Very, very, very glad. Please join me in a warm welcome.
Thank you. And thank you all so much for the invitation. I just want to give a little forewarning. I am currently at APA. My APA talk was scheduled for yesterday, but they moved it to today. And so I'm in a room that they will start breaking down in about 5 minutes. So hopefully you all will not hear the chaos in the room where I'm sort of currently posted up, and we can have as much of a discussion as we can have. But since I will have to leave a little bit earlier than your typical grand round speaker, please feel free to send me an email if there are questions that we just don't get to today. So I'm gonna start with this Yeats quote, because I think this is how, when I've been thinking about sort of the past 4 years and my work in that frame, this is one of the things that I've sort of been thinking about in terms of how things have sort of been falling apart, it seems, and how it seems that anarchy is yet again loosed upon the world. So you guys know I'm Wanjiku Njoroge. I'm at CHOP and Penn. Here are my disclosures. And we have a lot of objectives today to get through the next 40 minutes or so. I'm going to start because I think it's really important that we sort of set the framework. So I'm going to talk about the criticality of early neurodevelopment, as well as make sure that we have a shared language around the uses of race, racism, and discrimination. And then I'm going to sort of situate my work in the or what I'm going to talk about you all about today in terms of thinking about the COVID-19 pandemic and how it's disproportionately impacted different Americans. And then we'll get to sort of next steps. So the first part one, if you will. Again, as an infant preschool psychiatrist, I sort of came of age when Neurons Neighborhoods was in its sort of first iteration. And I found that really impactful in becoming an infant psychiatrist and doing further training after child because of the importance of the first 5 years of life. And so all of my work with clinical and research and policy have all been sort of framed around that perspective. So there are unparalleled changes that occur. As we all know, there's this sort of rapid growth, and there are a lot of early experiences that happen. And here's one of my favorite graphs I like to show that sort of really speaks to the changes that happen and the sort of the rapid and large amount of changes that happen in the first 3 years of life, and then really again in the first 5 years of life. And I think it's really important that we all realize that 90% of the brain develops in the first 5 years of life and what that means. So I also want to think about where children are developing in those first 5 years of life. And that really brings us to thinking, which I think we've been doing a lot of in the past decade, if not more, about the social determinants of health, and more specifically, the social determinants of mental health. And so I sort of put up here the a definition from the WHO, which I think is really important because it talks about these sort of the conditions that exist where people are born, grow, work, live, and age, but it also talks about these wider set of forces. And so the WHO sort of updated their initial definition of social determinant of health to take into account these sort of latter things, which really include economic policies and systems, developmental agendas, social norms, policies, and political systems. And that I think is really critical. We're thinking specifically about the United States and the work that I've been doing over, actually, I guess, my entire research career. So again, I'm hoping that we also understand that not only does early brain development occur in these sort of contexts, but also occurs within the sort of the socio-ecological model created by Brofenbender that talks about these concentric circles. And one of the things that's really important for me as a health equity researcher is really understanding the diversity of the nation and what that means for children of color when we're thinking about systems and development and how all of those things come together to impact early childhood development. Also critically important is really understanding when things don't go well and when children in these developing systems are stressed. As we've already talked about, there's this rapid development that happens in the first 5 years of life. And we know that some stress is fine, right? That every system needs a little bit of stress. But what we've talked about and has sort of entered the public sphere in sometimes increasingly weird ways is thinking about toxic stress or sort of these prolonged stress responses, which actually can be exceedingly damaging to this developing system. What's important to understand when we're thinking about this toxic stress or sort of these pervasive and continuing experiences that lead to this sort of developing system being sort of hit with wave after wave of increased cortisol is not just the context, but also the relationships that really matter in helping to sort of mitigate these sort of toxic experiences. When we're thinking about toxic stress, we've really sort of talked about it in terms of adverse childhood experiences and sort of looking back from the 80s and the Fleeting article, which sort of first defined ACEs. And that has really grown. And now we know that ACEs aren't just sort of those initial experiences, but also can include racism, which again, we're going to talk a little bit more about as we get into this talk. Importantly, this is another slide that I love to show because it can show what can happen when this developing system continues to be hit by this increased cortisol. And as you can see, it has these significant impacts on the brain development and brain anatomy, which then has impacts on how this little person may be acting within their home or their care environment, which I think is critically important when for those of us who see very young children, when they're coming into our clinic and there are sort of concerns that we sort of put all of these concerns, behaviors, symptoms into these larger perspectives. And again, to put like another pin on it and going back to NTN, which is really important, I think, in us understanding, if I haven't already sort of hit it home about the criticality of early neurodevelopment, is how early these experiences begin. And I'll talk about that a little bit more in sort of the next part 2, but that they really begin in this sort of prenatal period and they can extend. And so it's really important for those of us who really are very much interested in early intervention and even in prevention to really recognize how early we should probably be thinking about intervening. Okay, so that's part 1. So now those of you who are in training, I'm hoping I've convinced you to not only do a child fellowship, but also to do infant training. But let's also now talk about some common language around race. And again, I think most of this is stuff that's sort of pretty well trod territory by now. But I think it's always helpful to have a framework that we use in our conversations so that we're all on the same page. And so we all know that race is a social construct that we have used as a proxy for a lot of things over the years, but that it is rough and imprecise at best, and other times just wrong, and that it's not a biological or genetic construct. Discrimination, I think, is another term that we are more familiar with, and I think that we've all sort of are at the same level in terms of our understanding, and that it's sort of an unjust or prejudicial treatment because of a whole bunch of different categories in the way which we think about people. What's really important, I think, for us to understand is racism. And there are sort of multiple levels of racism that can be operating simultaneously. For the purposes of today's talk, I've really only included two forms of racism. What I'm calling structural racism, which sometimes has been called systemic or institutional. But again, there are sort of nuances in how we think about those things. And sometimes you'll see sort of very precise language that differs systemic from structural from institutional. But again, the sort of key factor is that these are large systems and structures, and that the policies that were created purposefully, and therefore these systems and structures are enacting in the way in which they were created. But what's important about these systems and structures is that they were created in ways to reinforce and even to perpetuate racial group inequities, usually with Black and Brown people having the inequitable portion of that system. The other form of racism, which I think we talk about a lot, which I think is a little bit much like discrimination, something that I think we sort of all understand, is personally mediated racism. But what's important about that is that there's sort of two ways in which this can be expressed. We've been talking a lot, at least at Chop and Pin, and I'm sure at UCF as well, in the past 5 years about implicit or unconscious racism, and also about explicit or conscious, which is I think what we usually think about. What's also important when we're talking about very little people is the ways in which racism can be experienced, and that it can be experienced directly or indirectly and vicariously. We also have talked a lot when we're thinking about racism and implicit biases, is really understanding, though implicit biases are activated involuntarily, so many times without intent or even awareness, that it really can still be exceedingly harmful, and that physicians are not exempt from unconscious bias. And that for any of you who have not yet done the Harvard IAT, I really suggest that you do it, because it really does help to make that become more clear. The other thing to think about are microaggressions, and those are things that happen all the time in terms of brief everyday exchanges that send denigrating messages to certain individuals because of their group membership. And I think that's really important because they occur all the time in a lot of different ways. But even though they're brief and even though they're everyday, they can still be exceedingly painful for those who experience them. Okay, so we sort of ran through that, but again, hopefully setting the base for thinking about what this means. Now let's sort of put those two things together. The criticality of early neurodevelopment, and sort of this common language on race, racism, and discrimination, to think about how little people experience these kinds of things. So my sort of earliest work as a fellow was really thinking about racism, looking at sort of historical records and looking at Drs. Kenneth and Mamie Clark's stall studies, which were really incredibly important and powerful, as two child psychologists who were very interested in the impacts of then segregation on preschool age children's development. They looked at a bunch of Black children and white children in the segregated South and the integrated North. And they really were very interested in looking at the psychological effects of segregation, because they really believed it was probably incredibly harmful for very little Black children growing up under segregation. So they did this through these two little baby dolls, which you see, where they asked these little children a series of questions about who's the prettiest, who's the smartest, who would you like to be your friend, who is the meanest, and which one looks most like you. And probably no surprise for many of you who know the doll studies or can kind of put together where I'm going. What they recognized was that Black children had very increasingly negative and stereotypical views of these Black baby dolls, specifically when compared to the white baby dolls, answering sort of all the things negative about the little Black dolls. But then that sort of last question, of which doll looks more like you, recognizing that they themselves looked like the doll, which they had just done all of these sort of negative ideas about. So the Clarks then sort of proved their hypothesis that segregation was really leading to this internalization of these negative views. What they didn't know then, what no one can know then, was that 14 years later, a young whippersnapper lawyer by the name of Thurgood Marshall and colleagues used their work and presented it in the 1954 Brown v. Board of Education ruling in front of the Supreme Court. Importantly, this was the first time in the history of the court that developmental psychological research had been used and was specifically decided and cited in the court's decision, which led to desegregation, or so we then thought, desegregation of American schools. So it's important to understand how that ruling and that developmental science really sort of show the impact, back in the 30s and 40s of segregation and of this sort of systemic racism on early childhood development. So fast forward to now, again, I, along with some colleagues, Uju Berry and Amalia Londono-Tobon, really were looking again at the impacts of racism on early childhood mental health and thinking about it specifically as a social determinant of health. And what we found during our looking at the literature was very similar to what the Clarks showed, but looking even further downstream and to the perinatal, infant, and toddler outcomes. And again, of probably no surprise to this audience at this point, there are long-term consequences of the sort of impact of racism and these disparities, not only on the infant, but on this dyad, which is really important when we're thinking about early neurodevelopment and relationships and the context that I spoke about earlier. And what's really important, and this goes back to when I was talking about the different forms of racism and the different forms of interpersonal or interpersonally mediated racism, is that women's experiences of discrimination reported during their pregnancy had an effect on their infant's social emotional development in the first year of life. So let me say that again, because I think that's critically important, is that women's experiences of racist discrimination during pregnancy had an impact on their infant social emotional development. And importantly, again, and this is using the everyday discrimination scale, which is a sort of quick and dirty scale created by David Williams and colleagues at Harvard, like 10, 11 questions. We use it a lot. That really also talked about not just the kinds of social emotional difficulties they had, but that they had problems with inhibition and separation and greater negative emotionality. And this was seen both at 6 months and a year of age. What we also found out in our sort of looking through the literature is that not only sort of is this vicarious or sort of this indirect exposure to racism, but that young children also have direct interpersonal experiences. And that's important. And that was sort of seen through some of the work that was done, not only by the Clarks, but other developmental researchers. But that as well as sort of this continued exposure to racism and their experiences of being with like their caregiver, their parent, a grown-up who directly experiences racism, and the little preschooler is with them at that time. This indirect exposure also can have significant developmental impacts, with there being this predictive of increased disruptive behaviors during adolescence. So again, I think importantly, this body of research really speaks to the impacts of racism, of discrimination in the early part of life, and how that carries forward through not only the infancy and preschool age, but also, thank you, but also through towards adolescence, early adolescence. What was also, I think, really very impactful for those of us who've been doing this work for a long period of time was this statement that came out by the AAP in 2019. And for those of you who didn't sort of hear about this statement, or sort of didn't recognize how profound it really was really that fact that the AAP, this like very powerful and large body, really sort of came out saying that talking about the profundity of racism. Again, the Clarks had shown this earlier in the 30s and 40s, and there have been researchers all throughout that have been talking about the profound impact that racism had. But for the AAP to come out and talk about it was really incredibly important and impactful. And so, the nation's pediatricians, I think, really gave a heft to it that this work had not necessarily had before. So I was doing this work, doing all this stuff, AAP coming out was all very exciting, and then this happened. So as we all know, those of us who were doing research had to freeze our research. Those of us who were doing clinical work had to sort of pivot and think a little bit differently about how we were going to do that work. And that's when I thought about this Chinua Achebe quote He has put a knife on the things that held us together, and we have fallen apart. So, like many of you, I was having a very hard time at the beginning of the pandemic, wasn't sleeping, was very stressed out, was worried about my family all across the country and world. And I started collecting headlines that really were talking about the disproportionate impact that COVID-19 was having on Black and Brown communities. And then reading headlines about the impact that the pandemic was having on very young children and families. And being worried about my clinic, how to keep the kids safe, who'd been on the wait list, whose parents still want to come in, what to do. And then thinking that though we had been saying we're all in this together, all of this data really began to prove that we weren't, right? That there were differences in who was becoming ill, who was being hospitalized, and who was dying from COVID-19. At the same time, I had just been reading about sort of Philadelphia and the Philadelphia Negro, by W.B. Du Bois. It was really thinking about Philadelphia, its systems, its structures, and thinking a lot about redlining. This is a historic map of Philadelphia and redlining. I think, again, this is a term that we've all become familiar with, but in the 30s and 40s, the Federal Home Loan Bank Board sort of asked the HLC to look at over 200 cities across the United States and create these so-called security maps that really indicated what they thought in terms of security for where folks should invest. This didn't just mean banks and schools and green spaces, but also the quality of homes. And the homes that were redlined, deemed hazardous, and the homes that were yellow, deemed definitely declining, then meant that those neighborhoods would not get the investment that the homes that were either in green or blue were going to get. Now, again, of no surprise to many of you who know the history of redlining, Black and Brown communities are the ones that were living in these red districts and in the yellow districts as well. I like to put up a map of the cities to which I'm talking. And so here's your redlining map from San Francisco. And those of you who do this work probably already familiar with this map. I would probably would believe that what happened in San Francisco is mirroring what happened in Philadelphia in terms of the pandemic. And here's a map of Oakland. You know, I just thought that was important too, since it's so close. And I know a lot of people go back and forth. So again, here are your sort of local redlining maps. But importantly, what was found with these redlining maps really was the fact that as a work coming out of Drexel was that the areas that had been redlined in our map was created in 1934 in Philadelphia were still the areas of the hardest hit by the COVID-19 pandemic. So Drexel did sort of yeoman's work in creating a series of maps, of which I've only just included 4 on this slide, but they sort of show where the sort of hardest hit areas in with COVID-19 infection, hospitalization, positive tests. They also looked at the building quality and the neighborhood quality of these maps as well. And again, sort of the folks who were hardest hit were living in historically redlined areas, which were also still the places where the largest amount of the Black community in Philadelphia lived. So again, this really just, I think, goes to show the pervasive nature of systemic and structural racism. That what was created in the 30s is impacting people centuries later in 2020. Think about sort of what we've talked about so far with early neurodevelopment, with racism, the way it impacts early neurodevelopment, and then the disproportionate impacts of the COVID-19 pandemic. I'm getting, just so we're clear, I'm getting a little note saying that my internet connection is unstable. So hopefully you guys are still with me. So this really great article came out in 2020 by Gravely from Florida in the American Journal of Human Biology. And importantly, it really spoke to thinking about this pandemic as a syndemic, which is thinking about this aggregation of 2 or more endemic and an epidemic condition, leading to this sort of adverse repercussions for health. So Gravely was thinking about it in terms of adults. And so some colleagues and I emailed him, all from CHOP, and we're just asking if we could adapt this for pediatric population, which he agreed. So this particular framework then thinks about the endemic conditions being structural racism, the sort of social environment, and the epidemic as a COVID-19 pandemic. And this is what I use to really frame what ended up becoming the work I've been doing for the past, actually 4 years now. So this first study started when we sent out a survey to all of the pregnant women in the Penn health system, which we got through the EHR. And of that, we had over 1,000 women that responded to our survey. And for the purposes of today's discussion, I've just included women who identified as Black and non-Latinx white, who were the largest numbers of our initial project and the ones that we've been following over the past 4 years. And as you will see, this is the first time that we found these women to report that there were differences, with the Black women having significantly more worries about their prenatal care and birth experience, as well as postnatal needs. Now, this is underneath the sort of experience of Black women in Philadelphia, where, as we all know, there's higher rates of morbidity and mortality for Black women. In Philadelphia, it's even higher than the nation's average, where we have 4 times higher rate of morbidity and mortality for Black women. And so these women were very concerned about what the pandemic meant for them. They're also concerned about what it might meant for their employment and the sort of lasting economic burden. We followed these women past their pregnancy into their delivery at time 2. And again, we found differences between the Black women and the non-Latinx white women, where again, these women were significantly more distressed at delivery. If you'll remember back to 2020, that is when birthing plans completely changed. So initially women couldn't have anyone in the L&D suite with them, just the woman, and then they're allowed to have sort of like one person. So for women who plan on having maybe their mothers and their partners and their sisters or whatever in the room with them, that could not happen. This is also really meaningful for Black women who may have had a doula with them, that they could not have the doula with them, or they had to make a choice. So many Black women were very concerned and feared for their life and for the life of their child. And again, there were these like negative effects of the pandemic that were greater on these women. And they also had higher experiences of racism, as we would expect. So my interest is really looking at the Black women specifically in thinking about the Black women in our study, overlying them where they currently lived with our historical redlining maps, and really thinking about the way in which the structural systemic racism, as well as interpersonal racism, was impacting them, knowing what we've known from the literature I've already shared. And so again, what we found, of no surprise, is women with higher racism scores and negative COVID-19 experiences really were associated with increased risks for postpartum depression and anxiety. That was both for like the redlining stuff, as well as for how they answered the sort of everyday experiences of discrimination. Okay, so then these women now, we follow them from pregnancy, delivery, postpartum, and now they have delivered their little infants and they're a month. So we decided it was important to look at not just the mother's experience, but also their child's experience. So we sent out a bunch of surveys to women who are still continuing to hang out with us and really looked at their mental health, the impact of the syndemic, racism, as well as resilience. And this is sort of some of the different constructs that we measured at 12 months. And then these are the tasks that we gave. Here are the 4 different toys. This was still happening, if you recall. At this time, it was 2021. So there were vaccines that were available, but there weren't any for children under the age of 16, much less children under the age of 4. So we decided to have all of this be virtual. So the tasks were all done through RedCap, or the service all done through RedCap for these 4 different toys. We sent a box to the family's home, and they were able to have these virtual visits. And we were looking at these sort of various things through coding of the videos and the way in which the dyad interacted on these 4 different tasks, as well as adding specific questionnaires to our 12-month survey to really get at the way in which parents were thinking about their child's development, as well as their own parenting practices. And here is the first paper out of that, looking at that particular cohort, which really sort of showed the sort of these continuing links about COVID and its impact on early child development. And this was also observed during this sort of dyadic virtual assessment, as well as throughout parent report. So the key points of sort of the earlier studies of this particular cohort was really again, giving evidence to the fact that these racial disparities related to COVID-19 were seen in our cohort throughout the entire peripartum period. And it really underscored, I think for me, that we really needed to understand how these stressors really impacted Black women and their very young children. So at that same time, I put in my R01, which was specifically looking at the impact of the pandemic on mothers and children with a focus on systemic effects on Black families. And with these three aims, again, we were looking not just at the risks, which had been sort of well-defined and well discussed, but also looking at resilience and thinking about this cohort that we'd got to know well now over the past 2 years. This is a longitudinal study. For my study, we decided to take just a subsection of women and really look at them at 24 months and 48 months, looking at sort of the dyads, as well as thinking about what was happening specifically with the mother's mental health when the children were 36 months. But I also thought it was important for us to include not just the mothers, which we've been looking at so far, but thinking of this sort of larger context and family, but what else that might include. And so looking at also other caregivers. So where are we now? Here's the current project. We are sort of looking longitudinally at these little people. We are trying to look at the differences across groups. We're also trying to understand better the psychosocial mechanisms. And here's where we currently are. We've sort of done time point 5, which I discussed with the video visits, the surveys to the moms and fathers and secondary caregivers, and those were defined as whomever the mother said was a secondary caregiver. We did the skid with the mom because we've given all these surveys, like asking about various questions about their mental health. We thought doing this clinical interview would be extremely helpful. And then we also thought, I thought, as a mixed methodologist, it'd be also important to look at a qualitative aspect by doing a qualitative interview with these mothers as well. So those were the pieces of the study. And now we're at the last active arm, which is time point 4, where we're doing video visits, again with the dyads. We sent out the link yesterday to enroll moms. And we're also giving, again, a bunch of mother surveys and father secondary caregiver surveys. Again, this slide is exceedingly hard to read, but I just wanted to give an idea. Okay, I wanted to give you all just an idea of the constructs that we're looking at again, what we've been asking both from the mothers and the father secondary caregivers in terms of surveys, and how we're looking at both sort of outcome and moderators. And as you can see, our surveys have grown from our initial sort of 20 or 30 to now, I think in our latest survey that we're asking parents, I think we settled on 417 questions, but it can be done in 30 minutes. And our parents have been great in continuing to complete these things. Okay. And here's the 24-month survey. Again, we sent home, because it worked so well, the 12-month survey. So we sent a box with 4 different toys to these families' homes for these 4 different tasks. And again, we filmed it. Yeah. And we filmed it. We just finished coding. So we're finding some very interesting things in the coding. So we'll tell you more about that when we have that. And then we completed the 36-month survey, which was on the skid. And again, we are going through that as we speak to look and see what we're kind of finding. And we're working on our sort of first manuscript about that. And then we did the qualitative interviews with a subset of Black mothers, 31, to really look specifically and ask them about their experiences during the pandemic, really trying to unpack this idea of the syndemic and what it really meant. And so we asked them a series of questions, which again, they were very forthcoming and talking about their concerns about that we'd sort of seen throughout our surveys, but really hadn't had the opportunity to delve into on any sort of depth. Because we've been trying to retain this little sample, we've done all kinds of things. So you can see here's some of our swag. We have these little t-shirts that we give to the kids at each of their birthdays. This is our year 4 t-shirt. We gave it to them at years 2 and 3, even though we're really done. And therefore we're still gonna give it to them at 5. We send little birthday cards. We send Mother's Day cards. We send newsletters. We do all kinds of things possible. We have cute little stickers. We formed a Black Moms advisory and advocacy board to really help us to engage. We have really tried to hold our families together and work within our communities, recognizing that it's only through that that we'll be able to retain this sample. And we're really transparent with families. In our newsletter, we now have a little QR code where we link to any talks that we've given, any blogs or anything that we've written about to let families know kind of what we're doing and how their participation has really helped to support our work. So what's next? So here we are entering the last active piece. We're really looking at the exposome and development, thinking again about these concentric circles, what that means. We are really understanding that the only way we can innovate is through collaboration. And that means collaboration, not just with community partners, but also research and policy partners and practice, right? It's all of us together really thinking about how we can be impactful and help these families and really understand what we are learning from their participation in these kinds of research projects. At the end of the day, this is the goal. It's equitable care for sort of all children and families. And again, we are working on some manuscripts, which we shall have out fairly soon. So stay tuned. And since I began with Chinua Achebe and sort of a dystopic view of where we are, I wanted to sort of end with two quotes. One is from this beautiful book. If you all haven't read it, I recommend it, Things Fall Apart. And this quote is, "A man who calls his kinsmen to a feast does not do so to save them from starving. They all have food in their own homes. When we gather together in the Moonlight Village, it is not because of the moon. Every man could see it from his own compound. We come together because it is good for kinsmen to do so." And that's why I think of grand rounds, right? Many of this work, much of this work I've talked about, is probably some things that maybe we already know. But we come together to talk about it because it is good for kinsmen to do so. I'll leave you with this last quote from Audre Lorde, one of my favorite poets, if not my favorite poet, which is what I think about when work is challenging and when times are tough, which is, "What I most regretted were my silences. Death, on the other hand, is the final silence. And that may be coming quickly now, without regard whether I'd ever spoken what needed to be said, or had only betrayed myself into small silences while I planned someday to speak, or waited for someone else's words. Because I am woman, because I am Black, because I am myself a Black woman warrior poet doing my work, come to ask you, are you doing yours?" Here's the team that made all this work possible, along with our families. So thank you all for your attention. I am going to move my computer. Hopefully we'll stay connected and we'll go on to Q&A. Okay, thank y'all.
Thank you. That was extraordinary power and grace under the circumstances. And you are a Black woman warrior scientist for sure. I am moved. I have goosebumps. If I could speak as well as you under so much going on in the background, pretty amazing. Okay, I know that Dr. Nikki Bush has a question. Go ahead, Nikki. You can go ahead and unmute yourself and I'll monitor the rest.
I want to give our presenter a second. Can you hear me?
I can hear you.
First, thank you so much for such an incredible synthesizing presentation. I do a lot of similar work.
Sorry about that. No worries. Yeah, sorry. I'm with you.
It's amazing how much you're accomplishing. And so my question is actually kind of larger and broader, like around how do you approach this work in terms of fields? It looks like you've got developmental psychology, you've got reflective narrative processes, you have observational coding, you have a clinical, you're using the SCID, and you also seem epidemiological and social psych and all of these things. Can you tell me about how you approach this work in your teams? Because I think that's something that a lot of people are moving forward, and you've been so successful in your study design of being so incredible in that regard. It would be useful to hear like how you think about fields and collaboration.
Yeah, well, I mean, I think it's just part of my training, right? As an infant preschool psychiatrist, it takes a village. For this work, luckily, I luck of having a bunch of folks with whom I've been able to collaborate sort of to bring in everyone's expertise, because I mean, I couldn't do this work on my own, as you could see from all the folks who've been helpful. Okay, I'm gonna sit here in the hallway. So yeah, I think it's just the nature of the work. And I think if you're really passionate about doing community engagement, then you're gonna need not just partners in academia, but partners in the community. I think that's partly also what we've been able to do
Well
through
said.
our Black Mom Advisory Group. Because I mean, I'm not from Philly. I'm from Missouri. And so, though I've lived in Philly multiple times throughout the course of my academic career, there were things I just didn't know about Philly, which is why I was reading The Philadelphia Negro, just to give some historical context. I think it's really important. Plus, both my brother and mother are historians. And so I think, again, that it's very helpful to have people who understand, who have been part of those communities, to be part of the work. And then adding that to all the other experts really, I think, gives us a much richer and much more nuanced picture of sort of what the concerns are. Because again, when this all happened, it was in the midst of the pandemic, right? So we weren't doing any research. And I was just sort of like not sleeping, like reading all these sort of like horrible things about what was going on and thinking about the community in which I like sort of live and serve, and thinking about how I could be helpful. But even though that's what I was thinking and reading, it still behooves one to actually ask people who are living in the community themselves about what they think would be most helpful. So again, I think, just having groups who are willing to work together, and the group that I pulled together for the R, we'd already started working together slightly before the pandemic. So we'd already realized that we could work across these different areas of expertise because, we all had our particular training and mindset, but together we just were better.
It's an excellent model for it. Thank you for sharing it with us.
Yeah, of course.
Dr. Marina Toulouse-Shams.
Hi, thank you so much for your talk today. I have a question about you started in the background talking about structural racism index and redlining, and we have a project in Rhode Island. It's a follow-up cohort study of young people who had first-time contact in the juvenile legal system, and we're continuing to follow them up. And we actually created like a statewide structural racism index with our team there, and had to do a lot of adaptations. And I was curious if you, based on like the locale, right, and all these other factors, and I was curious, are you doing any sort of like SRI data collection at the more macro level with this project too? I didn't hear it, and so I was just curious what your thoughts were about that, because we are also collecting qual data of perceptions of SRD, and you have this beautiful multi-method assessment. And I would love to swap notes with you about how to think about triangulating those data.
Yeah, no, that'd be great. We were actually just talking about some of the qualitative data that we gathered from the Black moms. And, one Black mom in particular was talking about, and this is now, we did the qual study when the babies were 36 months. So this is just like sort of this academic year. And many of these women, even though we asked about sort of pregnancy, we really sort of focused on, sort of past couple of years, but many of them went back to the pregnancy and sort of really talked about how much COVID-19 and some of the changes that happened in terms of the L&D suite impacted them. And so one mom's story I thought was really particularly striking and really just sad, because she talked about how she developed 2 birthing plans that she gave to her husband, but at that time wasn't allowed with her in the L&D suite. And one of them was if she survived, and one of them was if she died. And so again, and this is like, her kid's now 36 months, clearly they both live, but she was still sort of focused on having to make those kinds of birthing plans because she was concerned about the care that she was gonna get at Penn, right? The health system in which I work. And so I think that there are all of these very interesting things that families talk about. And there's some opportunities, like one of the things we also gave families is the CBCL, so there are opportunities for people sort of write in things. We also do the ASQSE, and people sort of use opportunities to sort of add other things about their experiences with these systemic factors. And so I think we're looking, very sort of interested in looking at these sort of differences across these women's experiences, across where they live. Some of our families have now since moved out of Philadelphia.
Yeah,
So
that was
trying to
gonna
look
be,
again.
that's what I was
So looking
wondering.
to see if they're again living in cities that were historically redlined, but recognizing that there were a lot of cities that weren't necessarily redlined, but that still had either covenants that were restrictive or still segregated in particular kinds of ways.
Yeah.
And so we're trying to look at those cities as well to get a better understanding, so we can put all of this into some sort of larger narrative. Yeah, it would be great. It would be great to, I'm sorry, I'm now going to my talk. It would be great to talk more about that. So yeah, but feel free to email me. And
Thank
for
you.
folks
Thank
who
you.
have
so much.
questions.
Wanjiku, I'm just gonna scream that it's wonderful to see you. This is Anne. How are you?
Okay, sorry, I have to go. They actually have already started.
Hi.
But thank you all so much for
so
your
much.
patience. I so appreciate your graciousness, and it's been a pleasure to talk with you guys, if only for a little bit of time. Okay,
Take care
email
of
me.
yourself. Take care of yourself.
Bye.
Bye, everyone.